Well, as we told you last week, Jefferson and Clallam counties are the first in our state to require proof of vaccination must be shown so you can go into restaurants and bars. As we told you earlier, Dow Constantine, the King County executive, is looking hard at the same issue here in King County, and my sources tell me that Jay Inslee is considering that to be statewide. So how exactly does this work? I know that both you and I have had a lot of questions. Dr. Allison Berry, she is with the Clallam and Jefferson County. She is their health officer for those counties. She joins us here on the Dori Monson Show. Dr. Berry, good to talk to you today. I appreciate it.
Thank you for having me.
Let's start with, and I always feel like I need to let people know where I'm coming from. I believe in the vax. I am vaccinated. My wife is. Our 3 daughters are. I'm very much against the government mandate. So with that as kind of my baseline, explain from your perspective why you think it is time to make people start showing their proof of vaccination.
Sure. So the primary issue here is reducing the risk of spread of COVID-19 in these high-risk areas. In Clallam and Jefferson counties, our healthcare system is overwhelmed. We are unable to provide the kind of medical care that people are used to receiving. We don't have enough beds or enough people to staff them. So we have to stem the tide of COVID-19 infections and hospitalizations. And the vaccines are the most effective way we have to do that. Vaccines and masks are really the 2 big things we have to fight COVID-19. In some environments, though, there are a couple environments where we routinely go indoors and take our masks off, and those are primarily bars and restaurants. Mm-hmm. That's what makes these places so high risk.
Have
just one quick thing. Yes, so we have actually. So one of our biggest outbreaks to date. One of our biggest outbreaks to date was related to a bar outbreak. Started with 17 infections and then went on to cause over 100 infections in our community with secondary infections from those people that were exposed.
Okay.
So we do know that the virus spreads there, but more importantly, what I was trying to finish saying is that we are actually trying to keep these businesses open. In most cases, when you see case rates like we have 1,000 cases per 100,000 in our community. When you see hospitals stretched beyond capacity, you would normally see businesses close. And we don't want to do that. I want to try to find a way to keep these bars and restaurants open.
I understand.
And that's why we move towards the mandate.
Okay. So here are my concerns. And I get where you're coming from. And I know that everybody has or I think most people have the right motives for what they are doing, yourself included. I am concerned about what this is doing to our rights. And one example is a couple of weeks ago, the U.S. Supreme Court said they would not extend the eviction moratorium because it's a clear violation of the Fifth Amendment to take people's private property, essentially, is what government was doing. And 3 justices who dissented said that because of a health emergency, that they are okay with suspending a constitutional protection. And that's what bothers me so much about this, Doctor, is that because of a health emergency, we have an awful lot of people within and without government who are looking at this as an opportunity to take away basic constitutional freedoms that we have.
Yeah, and so I would disagree with you there. I don't think we have a right to endanger other people. We don't have a right to decide that we can speed in school zones, for example. We don't have a right to smoke indoors at restaurants because we know that exposes fellow patrons and the workers to dangerous chemicals. So we have agreed that there is a social contract in this country that we don't endanger other people. And that's what we're talking about here.
We have something far more important than a social contract, and that is the contract of our Constitution. And the Constitution specifically says that government cannot take private property without just compensation. And that's why 6-3 Supreme Court ruled that we couldn't extend the eviction moratorium.
There's nothing about my order that has anything to do with taking someone's private property.
I understand, but my broader point is that if we are taking away constitutional rights in other cases, I'm not talking about what you're doing in Clallam and Jefferson, but I am very worried about the slippery slope.
Well, you've invited me here to talk about what we're doing in Clallam and Jefferson.
I'm very concerned about the slippery slope.
If we could stay focused on
this is a
COVID-19
wider issue,
and
Doctor.
these issues.
This is a wider issue.
I'm not quite sure why you invited me here to talk to you today.
Because
if you want to know about what we're
understand.
doing in Clallam, if you want to know about a healthcare system that's failing, if
Uh-huh.
you want to know about people dying and basic things that we can do to keep each other safe, I'm happy to talk to you about that. But I don't think there is a slippery slope here.
Okay, well, and you and I disagree on that, and that's why we're having this conversation. But my question, progressing from there, then, is what is the statutory authority that is granted to a health department to take away somebody's liquor license?
So the health department has an obligation. I, as the health officer, have an obligation to protect the public's health. That's really well laid out in state law. And so we do have an obligation to set forth policies that will protect the public's health. If a business doesn't comply with this order, of course, we always work very closely with that business to get them on board. Usually that involves calls, conversations. And I would say, for example, the mask mandate has been in place for quite some time. Right. In the entire time that we've had the mask mandate in Clallam and Jefferson counties, there has only been one business that we had to move forward with potentially removing a license. Okay. And then once we got to that point, they actually got on board. Everyone else comes around voluntarily.
I understood. But that doesn't answer my question, because my specific question is, can you cite anything that is codified that gives a health department statutory right to take away a liquor license? There seems to be so much cross-jurisdictional things happening here. And when that happens, then I think that things can spiral out of control.
So in order to operate a business, you have to have a wide variety of licenses. You have to have a food service permit. You have to have a liquor license, all those kind of things. In order to maintain those licenses, you have to follow the laws of the region in which your business exists. So if you are not following those laws, if you are not meeting basic health codes of the area in which your business is practicing, then those licenses can be revoked, and that has always been true.
And they can be revoked by the health department. So can you do that unilaterally if the liquor board was not on board? Can the health department?
No, we work closely with the Liquor and Cannabis Board. Okay,
so but you're telling me there is something codified that gives you that authority, that right to do so.
So there is something codified that gives me the right to write these orders. And then, as has been common practice, we work very closely with the various licensing agencies that license these businesses. So food service permits are licensed through our department. We have the ability to revoke those if someone is not following the rules of the jurisdiction. We also have the ability to work with our colleagues in the Liquor and Cannabis Board to revoke alcohol permits if necessary. And again, we always work closely with businesses to get them on board before that happens.
All right. I just didn't know that health departments had that kind of roll over liquor licenses. But tell you what, hold on, Allison. We're going to keep talking with Dr. Allison Berry. She's with the health department over in Clallam, Jefferson counties, where they are forcing vaccine passports to get into restaurants and bars. We'll continue the conversation in just a moment as the Dori Monson Show rolls on. When you said you're not worried about the slippery slope, because there are a lot of politicians, and I have no idea where you are on this issue, but there are an awful lot of politicians who would like to see dramatically more restrictions on guns, and they cite it as a public health hazard. And I think there are a lot of politicians who would be happy to try to bypass the Second Amendment under the guise of it being a public health crisis.
They're mandating that you have to show proof of vaccination to come into a restaurant or bar to eat indoors in particular has nothing to do with guns.
No, but you understand the broader issue that I'm
talking
about here.
I actually think you're trying to make an argument here. You're trying to make an argument about
I'm trying to understand points that I'm actually sincerely concerned about.
Yeah, I think you're trying to make a point that there is a slippery slope here. I think if you look at the COVID-19 response, you can see that we have actually this is a very cautious move. There were many more significant moves we could have taken in response to a healthcare system collapsing. In Clallam and Jefferson County, I have the authority, for example, to just close these businesses. I could have done that, but we didn't. We are trying very hard to be as focused and as minimal as possible in these mandates, and I think that shows. But I think you're fear-mongering and trying to make people
No,
scared about a slippery slope.
Please,
when there
now
really
you're just
isn't
playing
one.
games with that, because if you don't think that these are controversial issues, I mean, you have to understand that I'm asking questions on behalf of my listeners. When I have an opportunity to talk to a public official and try to get answers for tens of thousands of listeners, I'm not doing it to fearmonger. I'm doing it to try to shed light.
Yeah, but again, I don't think you're actually asking questions. I think you're trying to push a narrative. And that's not really what I'm here for. We do have a public briefing every Friday. We've been doing that since the beginning of the pandemic, and I'm happy to take questions at that, and I always do.
Okay.
But I do think that I think it's excessive.
What is the narrative you believe I'm trying to push?
It sounds like you're trying to push a slippery slope argument. You're trying to push the idea that because we are saying that you cannot come into an indoor space and take off your mask if you're unvaccinated and expose your neighboring patrons, somehow that has something to do with guns. It has nothing to do with guns.
No,
I'm saying
it has to do with
you invited me to answer your questions, so I'm answering them. It has nothing to do with guns that we say you can't speed in a school zone. No,
when we're talking about government,
if you want me to answer your questions,
exerting control over our lives. If you talk about government, whether it be the gun issue, whether it be the eviction moratorium, whether it be extra taxes for climate change, which we're told is the greatest threat facing us, I think that a lot of things are being pushed upon us by people who say that we are in a permanent state of emergency. And all I'm saying is I don't want the Constitution to be bypassed for this permanent state of emergency.
Could you tell me where in the Constitution it says you have a constitutionally protected right to go into a bar and spread COVID-19? Because I don't think it's there.
Of course not. That's a silly question.
No, sir.
COVID-19, nobody had heard of COVID-19 250 years ago. That's silly. I'm just talking about rights and freedoms.
So there are many places where we have to follow basic rules. So, for instance, you can't go into a bar or restaurant and smoke right now, right?
Right.
Does that mean someone's coming for your guns tomorrow? We've had that rule in place for years. Right. There are many basic rules that we sign up for to say that we will not endanger other people.
Right.
A functioning society protects its vulnerable and doesn't endanger other people.
You don't say if somebody comes and smokes in some bar owner's business, you don't take away their business license and shut them down. You punish the person who is the violator. You punish the person who's smoking. You give them a ticket.
No, that's actually not true. You misunderstand that. So if a bar or restaurant owner decided all of a sudden that they were going to say everybody who can come in here and can smoke, and we're just going to ignore the rule.
You can't do that. They can't do that. I've talked to guys all around the state who have tried to make that argument, and I have never agreed with that argument. But what I am saying is I do believe that we should punish the transgressor and not the people who are providing the venue for the transgression.
So again, the same is true here, though. So if an individual came into a business, tried to get past the rule and slipped in, that's never something that we would go after a business for. What we do enforce against is businesses that decide the rules don't apply to them, that anybody can come in here, no one has to be vaccinated, which is the same as the example I was just sharing about smoking.
Right.
If an individual, just like with masking, if an individual comes into a business, one person comes in and they slip through, we don't really worry about that. But if a business decides that they just don't follow rules, then we do revoke permits. But that's always been true.
And so in closing, do you think that everybody who is fearful about, what I've expressed, that we are seeing this incremental loss of freedoms and rights in order to protect public safety, I do believe that we need to always rely on a foundational guiding document like the Constitution to make sure that things don't go too far. And I mean, do you think that's an unreasonable point?
I absolutely agree with the idea that we need to hold the Constitution sacred. I'm a big fan of it too. I just don't believe that these basic public health measures to protect the public health and safety of our community have anything to do with what you're suggesting. Okay. We have all agreed to basic rules in our community to keep each other safe. And this is just another simple public health and safety measure.
Doctor, I appreciate you coming on with me this afternoon. Thanks for taking the time.
Thank you. Bye.
All right, Dr. Allison Berry, Health Director of Jefferson and Clallam counties. Love to know what you think about all this. You can text me at 98973. That's 98973. I do believe the more defensive our public officials are on these issues, the more fearful they are that maybe the people who question them have a reasonable point here. But I'd like to know what you think, because it is coming to King County. Dow Constein has made that pretty clear. So has Jay Inslee. It's just a matter of time. We have lots more straight ahead here on the Dori Monson Show.